7 Tuesday morning. And it's a big day for some families because from today, care home residents in England will be allowed to go out to see their loved ones without having to self-isolate for 2 weeks when they get back to their care home afterwards.
Yeah, let's have a look at those changes in some detail. Official guidance now says residents who leave a care home for low-risk visits, mainly outdoors, will not have to self-isolate when they come back.
They can visit a relative's garden or an outside public space or park, and they can go indoors to vote on Thursday. But there are kind of restrictions attached to this, aren't there? So they'll have to be accompanied by a nominated visitor on that journey or by a care worker. And residents must still self-isolate after leaving the home for a medical appointment. So if they're going to the doctor's or for a hospital, they'll still have to self-isolate then.
Residents in Wales can leave care homes as long as there is no COVID outbreak there without isolating on their return. And Scotland's guidance also allows residents to see loved ones outside of their care home.
But in Northern Ireland, the rules vary by region by region.
Well, campaigners believe this advisory guidance on care homes should be made legally binding and are delivering a petition to the UK government later today. Let's talk about this more with Jenny Morrison from Rights for Residents and also to the actor Ruthie Henschel, whose mum Gloria is in a care home. Morning both, thank you so much for joining us. We've spoken to you both on the programme before actually. Ruthie, just an update really, because I know that you're now able to see your mum. How much difference is that making?
Oh, huge, a huge difference. It's like night and day. As the carers in the home have said, it's like the lights are back on in her eyes because she can't talk anymore. But there is a huge difference. And I posted some pictures the other day and she looks 10 years younger. She looked, really wretched before, and it's the difference it's made. And I'm an essential carer, and the word essential is correct. And that is why we need to stop this postcode lottery that's going on with the care homes. And, people aren't following the guidance, so it needs to be law.
Let's talk to Jenny as well. Jenny, we spoke to you about your mum's situation. How will today's change affect what you can do with her? Will you take her out?
Good morning, John and Louise, and thanks for having me on this morning. It will certainly make a difference to my mum and also to myself and my family because mum's in a care home where the manager is sensible and is following the government guidance on visits in, and I presume will follow the guidance on visits out. So, I mean, we live quite near the seafront and mum's care home is also near the seafront. So, on a nice sunny day after, 14 months where she hasn't been outside, it will be amazing for us to, wheel mum down to the seafront, have a picnic. It will just be absolutely wonderful. And, we were overjoyed at the news. But as Ruthie has just said, our campaign came about, and certainly the petition, because despite the government, producing guidance for care homes to say that visits should happen and now visits out should happen, we're finding that there's widespread flouting and ignoring of the guidance. So as with visits into care homes, we'll probably have a situation where some families like myself and Ruthie, we're getting really good access and we're getting really good visits, and the managers have shown compassion and humanity and are doing all they can really to facilitate safe visits. But, John, I spoke to one of our members on the telephone yesterday, and the story was tragic. This man is an only child. His mum's in a care home, and he hasn't seen her for 14 months until recently. And when the guidelines changed, he was told that he can now come in and see his mum for 20 minutes only, once every month. And you've got people like myself and Ruthie. I'm going into mum's care home 3 times a week for hours on end. My sister's also going in to visit as well. And so, as Ruthie said, we've got this postcode lottery where some people are getting visits and others aren't. And it's really unacceptable because all care home residents should have the same rights to visitors.
Your heart breaks for anyone who's in that situation who can't do it. And I know that we get in our inbox terribly sad stories. But I suppose a care home manager might say, look, I'd love to be able to let families do this, but the circumstances in our home just don't allow it. Maybe the makeup or the experience that they've had over the last few or the cases that there have been or something like that, or even just location, geography, no big open spaces. You can see, Ruthie, maybe why some care homes just feel they can't do this and that they shouldn't be compelled to do it.
No, I can't see that. I'm sorry. I don't see that at all. We've now got unbelievable safety measures to put in place. And what about their human rights? Every other member of society gets to meet in groups of 6. If you look at just a carer, and we are their memories. For my mother, I'm her memories, and every other carer is going in, going out, going to ASDA, going to their children come home from school, their husband comes home from work, and they're allowed access in and out, in and out. We need that same kind of access. I go straight to my mother's room. I don't see anybody else. I don't come in contact with anybody else in that home. I have to have a test every time before I go in, and I can do that now myself because I can get the tests from the NHS. This is human rights that are being completely ignored from these beautiful people who are lonely and dying, isolated. As wonderful as a carer can be, they're not their family who know them. And this is breaking my heart, the stories, because it is completely wrong of these care homes to just make up their own rules. I understand that it's difficult, but my sisters can get one visit every 3 weeks because there's so many people trying to get in. There are safety measures.
Can I put this point, Jenny? And you both clearly are very passionate, and there are so many people in very similar and desperate situations. Care England, Jenny, its chief executive, have said if we had, and this is a quote from him, if we had a new variant and it was enshrined in law that essential caregivers could come and go, it would put people at grave risk. What's your response to that, Jenny?
Yeah, my response to Martin Green, Louise, is that, we need to get away from seeing, family members as just visitors. They're actually essential parts. They're an essential component of a person's care. We're not talking about throwing the doors open to care homes if cases rise or we have a new variant. What we're saying is, relatives are an extension of the care team. We were before, we didn't not care for our relatives before the pandemic. Some people used to go into a care home every single day to offer essential care for their loved one. And, we're not talking about throwing the doors open, let all family members in the middle of a pandemic, and our campaign's never been about that. But what we would say is, just as a paid carer is essential to someone's health, a family carer, just one family member, is absolutely vital to the mental health and well-being of residents. And I would say to Martin that by locking people out, you are trying to protect them from COVID, but completely ignoring the well-documented deaths where people have given up the will to live and died of loneliness and isolation. We're not talking about visitors, we're talking about essential family carers. And as Ruthie has said, this is a grave human rights issue, and the government aren't acting on it. It really incenses relatives, Louise, that only 2 weeks ago the Prime Minister dropped everything and sat down with everybody involved in what was considered to be a national emergency, which was the plight of football fans. And yet, the Prime Minister's not addressing this human rights abuse of care home residents, and families are distraught. And so I would say to Martin Green, it shows a staggering lack of understanding of their own residents, that they have a right to mental health and wellbeing support. It's not really enough just to keep people alive, to exist. They have to have something to live for, you know. And as Ruth has said, one essential visitor, even in the middle of a pandemic, could be subject to all the same infection control procedures as the paid carers, because we're an extension of that team. And again, as Ruth has said, we haven't got school-aged children in the main. We're not going to get a haircut. We're not, you know, beauty salons all the time. You know, we're not going to go out for meals and mix indoors with people. We're following all the rules. And, you know, carers are allowed to do all of these, have all these new freedoms, just as everybody else is. Yeah. And then go into a care home and go into every single room in that care home and offer personal care. And as Ruth has said, we're not asking to do that. We're asking for one family member to have the right to visit their loved one and support them in any situation. And it can be done safely, because we have all of the infection control procedures now to make that happen.
I'm so sorry to interrupt you. We are running out of time, though, so thank you very much indeed. I understand that you're both very passionate about this. That's Ruthie Henshaw and Jenny Morrison. Thank you very much indeed for your time this morning.
And the Department for Health and Social Care said in a statement to us, we know how difficult the last year has been for people in care homes, those who are most at risk from COVID-19. And they're talking about today being a significant step towards normal life with those restricted potential visits out.
Something else we wanted to talk about this morning is